Hello everyone, I'm Uday Krishanjana and my paper is the Advanced in Veterinary Diagnostics, a review of multimodal approach integrating hematology, urine analysis, cardiac and image parameters for disease detection in companion animals. So this is an overview of the presentation content. Now let's have a quick introduction. So nowadays most industries adapting AI for their business purposes. But when we consider the healthcare sector, human healthcare sector currently adapting AI integrations including multimodal approach. But when we consider the veterinary medicine, it is still lags behind the human healthcare sector. The major reason for that is the lack of funds that they receive for the research purposes. So the goal of my research is to review multimodal AI system integrating blood analysis, urine and cardiac, respiratory and imaging parameters to improve accuracy and efficiency. Now let's talk about the limitation in the traditional veterinary medicine. So main limitation is the communication barriers because animals can't verbalize their symptoms like humans. So veterinary medical staff always have to rely on the observable features and isolated lab test. So it is a time consuming one, and also when we consider the case, if it is a rare disease, the tools that they commonly use for the disease detection is might be failure because they does not have that much of exposure to those rare diseases. And also nowadays they use single modalities which integrate blood analysis data or imaging parameters. But the thing is, if the disease is a complex condition based one, those single modalities become fails. So because they have no adaptability for different variety type of parameters like multimodal approach. So it is essential to introduce AI driven multimodal approach to bridge this gap. So now let's have an overview idea of the current diagnostics modalities. And initially blood analysis. In blood analysis we use variety of parameters including hematology, biochemistry and biomarkers. So as the limitation we can consider the outsourced delays, species variability and poor sensitivity. So as the outsourcing delays, in case they does not have the sufficient requirement to conduct blood analysis, they have to outsource it, consume time. And when we consider the urine analysis, we use variety of parameters like color, urine specific gravity, pH. Now the main limitation in this here is the time consumption for manual processing and false positive as standalone procedure. So when we consider this you only based on the urine analysis, it might be fail because it is moved as the standalone object. Now let's talk about the cardiac parameters. In cardiac parameters, we mainly use the ECG and HRV. So major limitations are the requirement pre-preparations, artifacts and time consumption for manual analysis. So and also when we consider the respiratory parameters, we use variety of parameters including oximetry and capnography. So major limitations was the lab coat species specific standards and difficult to obtain patients cooperations because when we conducting the test among them, they might be panic, so it is very hard to get their cooperation for the observational or test cases. So at last the ocular imaging. So in the ocular imaging we mainly focus on the retinal scan and the TA analysis. So when we consider the ocular imaging as the limitation, we can identify standardization challenges across species and the restricted in some cases like cataracts. So if we face a case like cataracts, we cannot use ocular imaging. So if we have single model which can cooperate with the ocular imaging, it might be fail in this situation because it is restricted. So in that type of situation, multimodal approach is the most beneficial one because it is not just based on the ocular imaging, it can based on variety of parameters rather than one parameter. So now let's talk about the tick-borne disease. Tick-borne disease is the best for multimodal AI approach adaptation as an example. So tick-borne disease is the high exposure in common animals, basically the cats and dogs. So major limitation in here is the false positive and negative. In here PCR is the most accurate approach, but the thing is when we moving only with PCR, it is not sufficient. So we need to integrate it with the hematology or blood analysis. So in that type of situation, single modalities become failure case, and also therefore we have to move with the multimodal approach. Now let's talk about the multimodal AI in veterinary diagnostics. So in here just I first divide the healthcare sector into two different domains known as the human medicine and the veterinary medicine. Then I compare those two domains to identify veterinary medicine gaps including limited funding and dataset issues. So when we are developing multimodal AI solution for veterinary diagnosis, we have to consider various type of stuff like machine learning, deep learning tools for supervised and unsupervised learning for prediction, CNS for imaging, and also we have to follow the data fusion, early fusion, late fusion for modalities and feature engineering, and also we have to use the time series analysis because we move with the cardiac parameters, ECG, HRV. Most of the time they are comes from the waveform. So when we are working with the waveform data, time series analysis is the best approach. So we have to move with that. So and also we have to consider the XAI or explainable AI. So majorly explainable AI builds trust with the interpretable outputs. So majorly veterinary medical staff avoid the black box models because in the black box model they does not know what is happening inside the model. So there is an issue with the lack of transparency. So most of the time they prefer to use white box model rather than the black box model. So this is a visual summary of my entire paper. And when we consider the data acquisition for model development, we have two different approaches. So the first one is the gather the real world data, and also the second one is the usage of synthetic data. So when we consider the real world data gathering, so the major limitations or challenges are the inconsistent record, variability in anatomy, data scarcity, and privacy issues. So rather than that, if we move with the synthetic data, we can get benefits because it mimic the real world behavior without ethical risk. So when we consider the ethical risk, we have to we have to face variety of ethical risks like animal welfare, informed consent, data ownership, and bias in the underrepresentation of the animal species. And also there are some another level of risk like data breach or profit-driven AI recommendations. And also in case animal were considered as the property, it further complicates the ethics because of the dual nature of this property term, and also it might be caused to legal issues too. And also when we are developing this type of model, we have to consider the validation because it is very essential, because this is mainly belongs to the healthcare sector. One small slip might be a cause to crucial damage or even death. So in that type of situation, we can use the statistical method to evaluate the outcome of the model from the technical end, and also we can use the expert evaluation to check whether there are exist in hidden failure that we cannot identify as a technical perspective. So we are in that type of situation, we can incorporate their experience too. So this is a bar chart that's showing research acceleration, and we can see it is right skew bar chart, and more than 80% of the papers were published in 2020 to 2025 time period. And as the conclusion, traditional veterinary diagnosis is still limited by single modalities and observational dependence. So when we consider the crucialness of the illness, we have to adapt AI-driven multimodal system is very essential. And also when we are developing this type of model, we have to consider the ethical guidelines, and validation is also essential for real world development. So as the future direction, we can identify, develop standardizing dataset, species-specific XAI models, collaborative frameworks. And also, when we are going to commercialize this type of product, we have to move with the HITL, human in the top of the loop, because it's always ensure the white box in model development to avoid or address the challenges that we are facing while introducing this type of technique. So with that, I conclude my presentation, and thanks for listening.